Only use a PAPR if you have failed the fit testing for an N95, and you will be providing care for suspected or confirmed COVID-19 patients that includes aerosol-generating procedures.
Remove all lab coats or jackets. Remove all extra items from your pockets and any dangling jewelry. Do not answer your phone when wearing PPE. Each person donning a PAPR shall be assisted by a member of the staff who is not donning PPE. Pull long hair back from the face and secure. Perform hand hygiene using hand sanitizer or soap and water. This should be a two-person exercise. The second person reads the checklist and assists the team member who is donning and doffing PPE. Inspect all equipment for size and integrity, including the PAPR hood, gown, and gloves. Size the PAPR blower unit belt at the smallest part of the waist, not around the hips. Do not put it on yet.
There are two types of respirator units. One has a fixed battery, and the other has a removable battery. This video will demonstrate the removable battery.
Check the PAPR battery to ensure full bars. Attach the battery to the blower unit, listening for the click to indicate that the battery is in place. Insert the end of the PAPR hose with pins into the blower unit.
A separate airflow check is not necessary before donning, except in departments such as the ED and respiratory therapy, who maintain their own PAPRs.
Put on the PAPR blower unit and belt. Don the correct size gown to provide contact isolation protection. Ensure that air intake for the blower unit is not obstructed. Tuck the gown around and underneath the blower unit, and ensure that the string to tie the gown runs under the blower unit to keep the gown in place. Attach the PAPR hood to the PAPR hose, listening for the loud click to indicate that the hood is completely connected to the hose. Ensure that the hose is connected to the hood by gently pulling on the hood and the hose. Turn the PAPR on, ensuring that air is flowing into the hood. Don the PAPR hood, ensuring the gray headband is placed comfortably across the forehead and there are no folds at the seams. The hood should come in front of the ears to create a good seal. The air hose should not go under the gown, as this can cause it to kink or pull the hood out of place. The air hose should come over the shoulder, not under the arm. If wearing a PAPR hood with a shroud, the seam will not create a seal but should remain in front of the ears for proper fit. The inner shroud should be tucked smoothly under the contact isolation gown. The outer shroud should lay over the contact isolation gown. Perform hand hygiene using hand sanitizer or soap and water. With thumbs in the gown thumb holes, don gloves, ensuring they come over the top of the gown cuffs. Your partner will perform a safety check, ensuring all PPE is donned prior to the team member entering the room.
That concludes the donning demonstration. Now let's demonstrate the doffing procedure.
Prior to exiting the patient room, inspect for and disinfect any visible contamination using disinfection wipes. While inside the patient room, remove gown and gloves together. Avoid the neckline of the gown, grab at the shoulder and pull off, rolling in on itself, and discard in the trash. Perform hand hygiene using hand sanitizer or soap and water. Exit the patient room with the PAPR still in place. Perform hand hygiene using hand sanitizer or soap and water. Don a new set of gloves. Remember, when removing the PAPR hood, do not touch your face or hair. To remove the PAPR hood, with one hand, grab the hood where it connects to the hose. With the other hand, grab the edge of the hood under the chin. Lean forward and pull the hood over the back of the head and away from the body, moving from back to front. Be sure to avoid letting the hood touch the chest or clothing. Do not touch your face. Place the hood in the designated area for soiled equipment for disinfection. Remember, the hood will still be attached to the PAPR blower unit. If a second person is available to assist with doffing, they can hold the hood while the blower unit is being removed. Remove the gloves, perform hand hygiene, and then don clean gloves. The partner can now turn the blower unit off. Unclip the blower unit belt. Keep one hand on the blower unit to prevent it from falling when removing the belt. Disinfect the PAPR hood, hose, blower unit, and belt with disinfectant wipes and put away. Allow the hood to dry completely before storing. The hood can be reused until it is visibly soiled or damaged. Disinfect the designated area after PAPR blower unit, hose, and hood have been disinfected and put away.
Disinfect everything, including the canister of disinfecting wipes.
Remove your gloves and place in the trash. Perform hand hygiene using hand sanitizer or soap and water.